Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. Did you know that exposure to certain heavy metals has been shown to reduce bone density and increase your fracture risk? Well, this is something that's not typically talked about, yet it may be one of the underlying root causes of osteoporosis. And we're going to delve into this today with our special guest, Dr. Christine Schaffner. And Dr. Schaffner is a board-certified naturopathic physician who graduated from Fiore University in Seattle, Washington. And she is passionate about practicing medicine and creating healing spaces. Dr. Schaffner is the clinic director of Sophia Health Institute, the clinic she co-created with her mentor, Dr. Dietrich Klinghardt, in Woodinville, Washington. And at Sophia, they look for what are the root causes of chronic disease and illness. And one of the areas that they specialize in is environmental toxicity. Besides working at Sophia Health Institute, she sees patients in Marin Naturopathic Medicine in California, as well as Bella Fiore Organic Med Spa and Klinik in Seattle, Washington. And in today's interview, we talk about what are heavy metals, how do they interfere with our bones, and how do we test for them, and what can we do to detox from them. So lots of information in this interview, so stay tuned. Welcome, Dr. Schaffner. I am really thrilled to have you here. You've done so much, and I just think this topic of heavy metals is something that isn't really talked about when it comes to our bones, and people don't even know that this could be an issue. So I'm just really excited to have you and your expertise and bring this to our attention. So thank you so much.
Oh, well, thank you so much for the invitation, and I'm so excited to share this topic with your audience.
Oh, thanks. So let's just get started. Let's just dig right in because there's so much to cover. First of all, let's just go through the definition. Like, what are heavy metals?
Mm-hmm. Yeah, absolutely. And I think this is such an important topic, especially when we're thinking about bone health. In my work, I see a lot of chronic illness and I see a lot of chronic neurological illness. And we're looking at all of these factors, how our immune system and our environmental exposures really impact our body over time. And heavy metals are a big topic. I think there's more and more awareness around these things, and they're metallic elements in our environment that are heavy. So that's why they're called heavy metals, because of their atomic weight. Heavy metals can include things like mercury, lead, aluminum, arsenic, cadmium. There are trace elements that are really important for our health that are categorized as heavy metals, like iron and copper and chromium and selenium, and they do fit in that category as well. But what we're finding with heavy metals, that there are certain heavy metals that are going to be more toxic to our body, and they're going to be also, have an effect even at low doses. And so we can go in depth around that. But heavy metals are, again, if you remember from chemistry class and the periodic table, these are things that are going to have a higher atomic weight, they're going to have a higher density, and they're going to have an impact. Many of the heavy metals are actually classified as carcinogens. They can affect different tissues of our body, and we're going to be talking about bone health in particular, but I do find that the exposures that we're constantly bombarded with because of our societal exposures, that we bioaccumulate these things over time, and they do have an impact on our health and our bone health.
Okay, so let's go into which ones in particular are going to really have are going to be affecting our bones the most.
Yeah, so when I look at heavy metals, the ones that I'm always focusing on, I look a lot at mercury, I look a lot at lead, I look a lot at aluminum because of the impact on, us systemically, and of course our nervous system and our brain. But when we look at bone, we really look at lead, cadmium, and aluminum. And so each of these have, an impact. And I know you do so much education on bone health and actually what it means to have healthy bones. And there's multiple factors, right? So there's our genetics and our hormones and mechanical stress. But these environmental exposures can really kind of throw a wrench into our bone health because of the way that they impact our bone, our actual physical bone. And then when when heavy metals are stored in our bone, they can also, with bone remodeling, they can be released at different times. And I can walk us through a little bit, what I mean by that. Lead in particular, and people, I think, probably underestimate lead exposures because we think, oh, we have unleaded fuel right now. Lead paint is no longer, but we're still actually, if you live in an older home, you may still be exposed to lead paint. Airline fuel still is leaded. So that's a huge exposure, especially in the airline industry. And we know that people who work in the airline industry have a higher rates of certain chronic illnesses and neurological diseases and certain cancers as well. So we know, that these things, the lead is still pretty ubiquitous in our environment. I mean, also cosmetics can have lead, toys from China, unfortunately can have lead. So I think lead, people tend to underestimate the exposure. And just one side note, part of our work we do is you're looking at the impact of glyphosate and Roundup on our health, and we're pretty close with Dr. Senef, and she's educated us along the way. And we know all about, when I was interviewing her at, actually for the Heavy Metals Summit I did years ago, she reminded us about why there was probably such a problematic exposure in Flint, Michigan, and why there was lead in the water. We have these old leaded pipes, and Flint, Michigan also has, it's basically a community that has a high agricultural area, and they have a high amount of sugar beets that are often, they're basically genetically modified to withstand the spraying of Roundup. And so they have a lot of glyphosate going through the groundwater and getting into the pipes, and then glyphosate actually chelates that lead in the pipes to make it more, because glyphosate is a mineral chelator, and it amongst many other things. And so there was more lead in the water than there probably would have been in light of that exposure. And why I just bring that up, Margie, is because, we're going to talk about heavy metals, but it's, I often say when I'm talking about these things, 1 + 1 doesn't equal 2. We have this synergistic soup of different environmental toxicants that we're all exposed to. And, we can study these in isolation, but we don't really understand the physiological effects because of all of our unique exposures. So I just wanted to, presence that, because I think that's important when we're thinking about such topics. But,
say something about that. That's fascinating, because it's interesting. Glyphosate, which is, if some people don't know, the active ingredient in Roundup, that's unbelievable that in addition to doing so many other negative things to our health, it can actually affect the pipes. That's amazing. And Dr. Senef is going to come on and speak on glyphosate on the podcast. So I'm really excited about that.
Ask her about that. She's so much knowledge.
Wow, that's amazing.
She's connecting the dots of so many things, and I think she's just such a wealth of knowledge. So do ask her about that. So lead.
Can I say one other thing about lead, though? In terms of lead, people, as you said, they don't think it's in things, but also exposure, like a lot of us, in the 40s, 50s, or 60s who are exposed to it, it stays in your body.
Yeah, and it stays in our bones, So one of the things why lead is problematic to our bone health is that it can actually, because of its charge, so it's a 2+ heavy metal, and it can basically, in the absence or deficiency, or let me say it this way, when you have a lead exposure in excess, or even if you are deficient in calcium or magnesium, lead can take the place, of that essential element in our body and replace it. So what can happen is if you're not eating enough or absorbing calcium, or you're overexposed to lead, lead can take the place of a calcium element and get remodeled in the bone. So then we end up storing lead in our bones, and then through life processes and different hormonal shifts in our body through, especially with women, with either pregnancy or going through menopause where there's excessive bone remodeling, you can release that lead from the stored bones, and then that can be problematic if you're not aware of this because you can affect different tissues. So lead is a big one, Margie, and I think it's a really important heavy metal to consider, when we're thinking about bone health, for sure. And, it's not only lead has that relationship with calcium, but it also can affect our kidneys. And I'm sure you talk a lot to your audience about the role of kidney function in keeping our mineral balance healthy and our ability to absorb vitamin D, which helps us to absorb calcium, which is important to our bones. So it has, when you look at the literature, it has several ways and mechanisms that it relates to increased risk of osteoporosis or even bone fracturing. So it can weaken our bones. So that's lead.
Okay, that's lead. And you're right. The research has shown that there's a relationship with osteoporosis and bone loss. So, okay, so that's lead.
Yeah, yeah. And then the other, one that comes up in the research is cadmium. And there was a study that actually looked at blood levels of lead and cadmium and related it to low bone density. And so they saw when people had a higher blood level of these metals, which is a whole nother story. We can talk about testing. And if you actually have, lead in your blood or cadmium in your blood that's measurable, you're quite toxic with these things. But basically, they showed in this one study I was reviewing with people with higher blood heavy metals, they did show a correlation with lower bone density. So looking at that, we just talk about the impact of why that might be for lead. But cadmium also has an impact on bone remodeling and osteoblast activity. So our osteoblasts help us to build bone. So cadmium can impair that. And then cadmium also has an effect on our ability for our kidneys to absorb calcium and phosphorus and also activate vitamin D. So if all of that is not working in proper order, then we don't absorb calcium in our gut. So they have similar mechanisms as well, cadmium and lead. But cadmium, when we think about cadmium, cigarette smoking can be a source of cadmium. More industrial exposures can be related to cadmium. There are nickel and cadmium batteries, in our obviously in our life that we can get exposed to over time. But cadmium is something that I probably underestimate. When we look at strategies to detoxify heavy metals, we use a couple different strategies I can talk about in a moment. But when I'm thinking about mercury and lead, those same agents also take care of cadmium. So I think sometimes I underestimate really the impact that cadmium has on our overall health and our bone health in particular. And I'm always, surprised when I see a high cadmium level because I don't think cadmium maybe it is talked about as much.
Interesting. Wow. And so the other one you had mentioned was aluminum.
Yeah, so
that's everywhere.
Aluminum, we talk a lot about aluminum in our community, especially with its impact on brain health. Aluminum is definitely implicated in cognitive decline, and we see it have a huge impact. Chris Exley is one of the professors that we follow, and he studied not only brains of deceased patients of Alzheimer's and found a statistically significant amount of aluminum in their brain, but he also looked at children with autism who have passed and saw the same thing. So we know that aluminum is a huge has a huge role in our brain health, and then it also affects our bone metabolism as well. So it also can, affect bone remodeling and actually osteoblast activity as well. And so when we think about cadmium, lead, and in aluminum, we think about actually the physical impact on how we create new healthy bone, and then also how we can get the proper minerals, in our bones. So this can be detrimental because we're replacing these heavy metals for essential nutrients in our bone. And then, of course, we think about kidney function and how heavy metals often affect the nephrons, and that has a whole host of implications with basically all the electrolyte and mineral absorption that we need to do, and vitamin D activation, as I've mentioned a few times. So that's just a high level overview, Margie, of how these heavy metals can affect bone health. And just with my philosophy and my perspective and what I see every day, I think that even if you are in good health, we need to think about our toxicant exposure and how that can impact us over time. And, if we want a healthy brain, a healthy heart, healthy bones, as we age, we need to think about living a lifestyle of detoxification to really help us reduce our body burden of these things to remain healthy.
That's so interesting. The question on aluminum is that let's just talk about where it's found. I mean, we know aluminum in deodorants, we know about aluminum foil, but what about, an interesting thing I was thinking about as you were speaking, antacids still have aluminum in them. And it's very interesting because people who are on antacids, actually there's a correlation with osteoporosis, and it's usually thought because of stomach acid. They're reducing the stomach acid, and so you may not get absorption of nutrients. But here I'm sitting here thinking, could be the aluminum as well in the antacids.
I think that's a really important insight and connection. And you mentioned a bunch of exposures. So we have medications, we have food additives. A lot of the food coloring that we find in our foods is aluminum-like derived additives. We also, in our water, some water filtration systems, meaning municipal, so before it gets to your home, use aluminum to actually aluminum sulfate in the water to help get rid of certain bacteria that they can't without doing that. And so we're really big into water filtration for lots of reasons, not only reducing aluminum, also fluoride in the water. Arsenic can be in the water, as well. So a good water filter, goes a long way. And then, vaccines have aluminum adjuvants that can be problematic for a lot of people. But there was a documentary, The Age of Aluminium, because it was made in Europe. We're just inundated from, just our food, our water, our personal care products, our medications, all of these things are an exposure to aluminum.
Oh, that's great. So the question is, do people who are listening, do you find that most people have signs and symptoms of this heavy metal toxicity, or do some people, is it silent?
Yeah, it goes both ways, I feel, Margie. So when I'm seeing patients, there are definitely non-specific symptoms that can be related to heavy metal heavy metal exposure. But a lot of the things that we see that could be related to heavy metal exposure are a lot of different neurological symptoms. We look at everything from brain fog, cognitive impairment, any of those things can be related to heavy metal toxicity. Different pain pictures in the body, like fibromyalgia to musculoskeletal pain, can be related to heavy metals because of how heavy metals can create inflammation in our connective tissue. Heavy metals can also be problematic overall for one's immune system. They can be immunosuppressive and be a factor in affecting people's overall immune health. They can also lead to a lot of vascular inflammation and can be problematic with any type of circulatory issue. They can be endocrine disruptors, so we can see a lot of thyroid conditions, and our thyroid gland is heavily affected by heavy metals. So it's not, unfortunately, I don't just have a checklist. If you have symptoms, you look for heavy metals. I mean, I'm pretty jaded with the work I do, and I think that everybody should just know that they've had if they live on the planet at this point, we've all been exposed to heavy metals. The difference though, Margie, as we all know, is we all have our unique blueprint and individuality, and I'm a firm believer in epigenetics, just not genetics alone, but how, our environment and our emotional health affects our epigenetic or genetic expression. But some of us are going to be naturally a little bit better at detoxifying heavy metals than others. So depending on our liver metabolism and certain methylation factors, so we may have an easier time, than others. So it's all, very individual. And I do think again, we should all be thinking if you're chronically ill, like definitely consider heavy metals as part of your overall strategy to get better. If you're dealing with bone health issues and osteopenia, osteoporosis, please look at, addressing heavy metals as a way to having healthy bones. But if you want to just maintain your health and preserve your brain and your bones and your heart and all the important systems in the body, just really living a lifestyle to help, I kind of think of, the simplistic model of like how full is our bucket, right? And how do we, empty our bucket and, keep things flowing in our body so we can keep up, with all of the daily processes of metabolic function and not be overburdened by environmental factors.
Oh, I love this. So the interesting thing with osteoporosis is my belief is that people really need to get to the root cause. And this is just something that they do certain testing, conventional physicians, but this is typically not done at all. And yet it could be a significant factor in someone's bone health. So the question is, what testing do you recommend?
Yeah, absolutely. And I think this is where, medicine is not black or white, right? And that's the hard part, especially when we're trying to really, have a linear model and a linear paradigm, especially in the conventional model, right? They want an objective test and an objective treatment and, see you later, right? But heavy metal testing can be a little bit in that area of gray because remember, when we're exposed to heavy metals, we can basically store these metals in different body compartments and body tissues. And so when we do, traditionally in conventional medicine, they'll look at your blood levels of a heavy metal like lead or aluminum or cadmium or arsenic. And, our body actually is quite wise. And if we have metal circulating in our blood, we're highly exposed and highly toxic. We often take those circulating metals and store them in different tissues to protect ourselves. And so, blood is one way, but I would strongly caution you if you have a negative, metal test via blood, don't, stop there, keep looking. There are other ways to look at heavy metals, and we can look at them in the hair, the stool, the urine. Functional medicine doctors and naturopathic physicians often use what we call a urine provocation test. And so they'll do a pre and post challenge test. We often just do a post challenge test just to skip a step. But what that means is they'll have you just collect your urine and, see what basically looking at different heavy metals and seeing what's coming out in the urine. And then they'll do what we call a provocation where we will give you a metal complexing agent, something like DMSA or DMPS or EDTA. And what those agents do is they preferentially bind to different heavy metals, especially lead and mercury. And depending on, which one you use, they're metabolized a little bit differently. But the goal is to take those agents and then collect your urine anywhere from 6 to 24 hours and see what the body is eliminating. And so this would be called a urine provocation test. Again, it's not a perfect test because, again, we need to see how someone handles those agents as well as given, it's a snapshot, right? We're just giving this one agent and it's going to just kind of sweep through and see what it can grab. But, we have, the areas where we have metals and that they're most problematic are really hard to test, right? It's really hard to measure metals in the brain or even the bone for that matter, but we can, paint a picture, and then we do a little bit of an alternative test at Sophia. It's called the oligo scan, and it actually uses something called spectrophotometry. So it's looking at light, and you put the monitor on the palm of the hand, and through principles of light and resonance, they can pick up, the device picks up mineral and metal testing. And so it's another snapshot to see the body burden. And so if I had, if my patients, had all the support to get all these tests, it'd be great to see the blood, pre and post urine provocation, the oligo scan. Hair testing, I don't use as much in practice anymore. It just kind of looks at more of an acute exposure, but it doesn't give us the full picture. I'm in practice more use the urine provocation as well as the oligo scan to just paint this picture. And then one of the things, again, that we have to change our thinking around and our paradigm around is that, again, this is a snapshot, and, when we're looking at metals, but metals, especially when you're on a program, they can come out in waves, right? So when, depending on when we're testing and kind of how the patient's going through, it's not like we just have this, line of heavy metals and then we're getting our lead level down per the test and then we're done. But as we clean up more superficial tissues in the body, then kind of medium tissues in the body, and then deeper tissues in the body, metals can come out in waves. I have this one patient I'm thinking about right now, and we've done a lot of metal detox for her, but we've kind of gotten to this next level where we're really getting and accessing the metals that are in her central nervous system, and it's this deeper level of treatment, but it's taken us almost years to get there. And so I'm humbled every day, Margie, of how much metal detox people need. It just is mind-bending in a lot of ways, that it's definitely a marathon, not a sprint. And that's why I like to paint the picture of this being a lifestyle and kind of just something that we need to assume. And then depending on your health and your health goals, and of course your practitioner team, you choose the agents that you need at the time to support getting this metal burden out of your body.
And can we just touch on that, the detox? So someone finds out, they do the test. So it sounds like typically in the best scenario, you do a couple of these tests so that you really have a better picture, but you really at the present time are not using the hair analysis, which is interesting. And so then when you
can use the hair analysis. I'm just saying clinically I don't right now, but there are practitioners who do. Yeah.
But if just the hair analysis, if someone just did that, that's probably not enough. Is that your feeling?
Yeah, I feel like I think to get the full picture, looking at all of these tests in context is going to be the most helpful. But, also what's available to you. I mean, right, medicine is this art of, hey, we think of the perfect scenario, and then we have to work with our patients, right, and their resources and what they're able to do and what they have access to. But yes, testing isn't perfect, but there's a lot of options out there too.
Okay, great. And so they find out that they have the heavy metals, which is quite common. That's the crazy thing. And I know this is what your practice is. So I know you see this all the time, where if it's not looked for, we have no idea if people are involved or not. But my question to you is, so then just give us a little bit about the detox, what occurs with that.
Yeah, absolutely. And so with the detox, what we do is, it's multifactorial, but what we like to do is look at the body and, I'm a naturopathic doctor, so I'm always thinking about supporting people's organs of elimination first. And so we're thinking about having really good routes of elimination open. So through the kidneys, through the liver and the gallbladder, through the colon, the lungs, the skin, and we have natural ways to do that. So through herbs and different supplements to support phase 1 and 2 and 3 detoxification. A big foundational part of our protocols are using binders. Binders are different substances like chlorella, certain clays, charcoals, modified citrus pectins, different silica-based binders. And binders help to bind toxicants that come out through the bile. So bile is produced by the liver. It gets excreted through the gallbladder, and through the gallbladder through the intestines. It helps to emulsify fat that we're eating, but it also helps to eliminate a lot of our environmental toxicants, and then the bile gets removed through the stool. However, if you don't have proper bowel movements or you tend to be constipated, what can happen is that there's a natural part of this recycling that it's called the enterohepatic recirculation, and that we can reabsorb those toxicants that the liver tries so hard to get rid of. And so binders are sitting in the intestines waiting to bind to those toxicants and really ensure that we get them out through our bowels. And so binders are really foundational. They help make any protocol that we do successful. We always want to also support people with minerals. If you have mineral deficiencies, it's going to be harder for you to excrete certain heavy metals because your body is going to be in what we call a metal retention pattern. And a metal retention pattern is when in the light of certain deficiencies, our body doesn't have the resources to excrete those metals because it needs something to fill that place. And so we like to support our body, our patients' protocols with a lot of trace minerals that are really important cofactors to help get metals out, like zinc and magnesium and a lot of B vitamins as well. So that's all real foundational. And then we use different agents. So depending on where people are at, we can use herbs like cilantro, which is a metal mobilizer, a natural substance to help mobilize heavy metals. We'll use actually a lot of melatonin. Melatonin is not only a sleep aid and helps with our circadian rhythm, but it also helps to detoxify metals, especially from our brain and our central nervous system. And so we'll use natural agents, and then sometimes we'll use agents like DMPS, which is an injectable chelator that is a really strong binder for mercury, DMSA, which is an oral compounded medication that is also a strong chelator for lead, as well as mercury. We sometimes use EDTA IVs that also are really great for taking out lead and mercury. EDTA is also available in different supplements as well as suppositories. So, there's no cookbook way of doing it.
Right.
It's definitely a combination of tools, and that's why you want to work with somebody who does this all day long so that we can support you. And then we use a lot of our naturopathic foundations and our protocols like coffee enemas and sauna therapy or colonics, or even the ionic foot bath, surprisingly, works really well to help increase urinary excretion of heavy metals. And then we can combine that with IV therapy and then, lymph drainage. So it's, we look at this really comprehensively because, we have to, for our patients, again, but if you're kind of scratching your head and don't know where to start, just take stock of your body and see, really, are your routes of elimination, moving well? Or are you getting good movement? Do you sweat on a regular basis? Are you breathing? That's a simple question, but it's funny how much we don't breathe. And are you drinking clean, healthy water? Do you have minerals, that you're, not only eating a healthy, mineral-rich diet, even though which is really hard to do because our soil is so deficient right now, but are you repleting with minerals? And then, binders are a good place to start. One thing I haven't mentioned, Margie, that I want to make sure I do mention is that, it's really important when you embark on a detoxification protocol, especially if you are using chelators, that you don't have any silver fillings. So silver fillings are a amalgam of different metals, especially mercury. And mercury is one of the most neurotoxic substances on the planet, and it's just awful that people have that in their mouth still, because it can be so impactful and detrimental to people's cognitive health as well as their systemic health. So please don't work with anybody or do any chelating strategies if you haven't addressed your mouth first, which is really an important part of our work as well.
And one thing about that is, don't just go to your regular dentist and ask to have them taken out. You really need to go to a dentist. I guess it's called a biologic dentist, someone who has certain, it's very different how they do it. They take precautions so that you don't get more mercury as they're extracting it. But that's really a wonderful point. So who should people are listening, and I don't think you can work with everyone. Do you ever work with people who aren't where you live, or?
Yeah, a lot of patients come from out of town to come see us, and then we have to establish care though in person, and then we
Mhm.
can keep up with people in between visits on the phone. No, I know that everyone who's listening is probably from all over. And, I think we have the exciting thing about my perspective of where we're at in medicine right now is that there's so much more awareness. There are people like you, Margie, who are educating your community, and we're really all wanting to figure out what the root cause, is of why we have any health imbalance. And it's not just about taking a pharmaceutical or, so forth. I think people really want more, and there's more education out there. If you want to find a trusted provider, there's several, ways to do this. Of course, there's the functional medicine, group, the Institute for Functional Medicine, and many functional medicine doctors are trained at looking at heavy metals. Also there is, the field of naturopathic medicine. We're a smaller profession. We're not licensed in every state, but, I think we have a great profession and do really great work. There's also the American Academy for Environmental Medicine, who are also a blend of MDs and DOs and NDs, who are trained in looking at environmental causes of why people are sick. And so those are some starting points, to think about. But there are, I'm a firm believer as as your awareness increases, you'd be probably surprised about who is in your community that you have access to that you might not have thought about because it wasn't on your radar yet.
That's what's so wonderful about this, because it's not on people's radar. In terms of the community with people with osteoporosis, it's, everyone knows about exercise and they're starting to get aware of food, but it typically, a lot of times in in conventional medication, in medicine, people are just put on a medication to stop bone loss. And so they're not even looking into the root cause. But this is one that I think is probably more prevalent than we know, because it's really not tested for. So it'll be very interesting, when people do test and see. And I'm sure you've seen miracles from the work that you're doing in terms of you want to just share maybe just a little bit about what you see once you address these heavy metals when this is a condition?
Yeah, absolutely. Heavy metal detoxification can be such a rewarding part of our work. Things that I see clear up are a whole host of neurological symptoms, but something I didn't mention when we went down the symptom list is looking at anxiety and depression. I do see a lot of people who have for all sorts of reasons, of course, but you'd be surprised about how, depression can lift when people go through proper detoxification and getting rid of heavy metals. And so that's a really rewarding part of the work. And then, of course, with heavy metal detoxification, we just see a lot of, brain fog clear up, especially. I mean, I have patients, my patients are usually tougher than this example that I share, but, sometimes when people have had silver fillings, for a very long time, and then they get them removed, they feel kind of a lifting and a fog clear out of their head, pretty immediately. And that's always really fun when it's in that instant for people.
Oh, that's great. This has really been so. Is there anything else well, first of all, tell us how we can get in touch with you or stay in touch, because I love where you work, and Sophia does so much in terms of, you really have so many educational materials that are fabulous. I just think you've done an incredible job. So how can people stay in touch or learn more about you?
Oh, thanks, Margie. So we have a clinic. It's called Sophia Health Institute. It's outside of Woodinville, or it's outside of Seattle, Washington in Woodinville. And then I have a website called drchristineschaffner.com. And I have information about my podcast and where I see patients. And yeah, we're really committed. I think it's a really exciting time in a lot of ways where we can share more information. We have so many platforms to do that. And so we're trying to do our part of sharing, what we know today and what we see to work. And it's always an evolution, but it's been really quite, rewarding to just be able to share this information outside the confines of our clinic alone.
Oh, and it's just so wonderful to share it with this community, because I think it is a missing piece. And that's sort of why I started this podcast, because I think there's so many things that exist that people aren't aware of. And so once they can get into the awareness, people can take action and have more results and really get to the bottom of this. So this has just been incredible. And I can't thank you enough for sharing all this great knowledge with everyone and for the work you do. You're really making such a huge impact on the world, truly. And I love all the things, and I've taken some of your programs, and I've learned a tremendous amount. So thank you so much for all this, and just thank you for sharing it with this community, and hope to stay in touch. And I know I usually see you at the meeting in the summer, so
Yeah.
look forward to that as well. So thank you so much. So appreciate this.
Oh, thank you so much, Margie. It was a lot of fun, so thank you.
I hope you've enjoyed today's interview with Dr. Schaffner as much as I have, and now a better understanding of heavy metals and how they can be impacting our bone health. All the links we talked about are in the show notes. So bye for now, and I look forward to seeing you next time. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.